So what do you know about AMR, or rather antimicrobial resistance? Antimicrobial resistance, or AMR, what is it? What we're doing about it? What's going on about it in the UK and globally for that matter? It's a very, very important topic, and it's something that medics, dentists alike are actively involved in at different levels to try and work with and resolve over the coming years and decades, because it's such a significant issue. And I think that's why they want awareness building amongst prospective medical and dental students, and that's why it's coming up in medical school and dental interviews. And I can understand why that is the case. AMR, I'm going to refer to it as AMR from here on. AMR is a major concern in the UK and abroad, guys, and it's important you really get to grips with the topic so that you can discuss it from different angles, different perspectives, should it come up, and depending on the type of question they might ask you, whether it's a role play, whether it's a non-role play, whether it's a scenario-based, fact-based, ethical-based question, you can deal with it hopefully if it comes up. For that to be the case, you need to understand the topic well. So make sure you do that with all the topics that we suggest. Not only that, kind of use this as a template in how you might approach other topics as well. So very quickly, what is AMR? What is antimicrobial resistance? Well, first of all, make sure you understand key concepts such as antibiotics. What is it? Well, antibiotics simply a drug that kills or inhibits growth of bacteria. And basically it's to prevent any bacterial infections and to cure bacterial infections. And then the other side, you've got antimicrobials, or microbe, as in besides bacteria, you've got virus, you've got fungus and parasites and so forth. Well, we also have like antifungals and antimicrobials that can also fight those kind of organisms. So it's not just about the major fight is bacteria and antibiotics, but we also look at other antimicrobials because we do have concerns with those microbes as well. And resistance simply means that particular organism has become resistant to the antibiotic or the antimicrobial to which it was sensitive before. So what is the problem with AMR? Yes, AMR is happening. It's worsening around us. What's the big deal? Well, it is a massive deal because of increased morbidity and mortality, sadly, that we're coming across. Increasingly, more and more people are becoming more sick and sicker, if you like, from infections and our inability to cure them or treat them. Increasingly, we're seeing more people are dying from strains of microbes and bacteria because we aren't able to cure them and we aren't able to slow down and get rid of their infection. And that's having a major impact on everything else we do in healthcare. So whether it's about looking after their diabetes, whether it's about looking after their kidney disease or heart disease or epilepsy, having an infection in your body, as you can imagine, will make other conditions worse. So, or you lose focus on those conditions because you're too busy dealing with things like an acute infection they're suffering from. It has an impact on like anything else that they may need. For example, a cancer patient in need of chemotherapy, and you can't do it because they are infected. Somebody needs surgery, they need a hip replacement, but they've got infection in the blood that can set off a septic joint, so you can't do the surgery. You can't even put them under anesthetic to do any operations. They've got an infection in the body, so the dentist can't do the work that they need to do with the root canal or the implants or the dentures or whatever they need to do, or major facial surgery or anything can't be done because of ongoing infections. So you see, infection has a massive impact on our patients' healthcare in other ways. See, the World Health Organization identifies AMR as one of its top 10 priorities globally. And from that perspective, we are trying to tackle AMR from a global, holistic point of view via humans, via animals and food supply chains. They're also looking at the prioritization of developing new drugs. A lot of pharmaceutical companies tend to focus on drugs which are high yield, i.e. drugs which will sell better in the market later on. Antibiotics or antimicrobials, as you might know, don't necessarily generate high income afterwards, and that's supposedly one of the reasons why there isn't the traction behind research for antimicrobials in general. And so this is where governments have to step in, and we saw an example of that during COVID, where various governments incentivized and worked with pharmaceutical companies to develop the COVID vaccine. Now, how do we arrive at the point where we see AMR? Well, I think there's 2 or 3 different angles you can look at it from. One, and big one in my opinion, is misuse. Misuse by humans, i.e. people being able to buy antibiotics easily, access antibiotics easily, and they're taking it when they don't need to. An example would be somebody's got the common cold and they feel they need an antibiotic, and they either go and buy it from the chemist, like they can do abroad in a lot of countries. In the UK, we can't do that, but we do see patients who will come with a cough and a cold, or something that the doctor might deem or the dentist might deem as it will just resolve on its own, but the patient's wanting antibiotic. Or the other scenario where the healthcare professional liberally prescribes the antimicrobial without needing to in that situation. We have a similar abuse issue, misuse issue, or overuse issue in agriculture as well, in that the overuse of antibiotics to help promote growth of livestock. And we've seen that a major problem across the world. And so, there's efforts going on between governments to try and control that. And then, of course, very important, poor hygiene, poor infection control in hospitals, in dental surgeries, in GP surgeries, in industry and so forth, where because you've got poor infection control, there is more chance of infections, sitting around causing mischief to patients and livestock and other people alike. And so these are organisms which are repeatedly exposed to antimicrobials, antibiotics, or they're not gotten rid of through good hygiene protocols. What happens is these organisms, they are mutating, and so they develop DNA capability to render the drugs ineffective, essentially. What they do is that when they replicate, they transfer those genes to new progeny. So they are actually created or born, if you like, with those mutations in situ. So they are born resistant to these antimicrobials. Some of them are clever and form like coatings and films and other, around them, so that they can get past the antibiotic or the antimicrobial and render them ineffective. So what have we been doing in the UK about this? Well, I can think of a number of things the UK government has done, the healthcare sector, the agriculture sector, industry sector. One of those policies the UK came up with was the 5-year AMR strategy, and that concludes this year in 2024. So it started in 2019, and a few key headlines there were to reduce the use of unintentional use of antimicrobials, so reducing prescribing, reducing access, other ways to deal with infections, hygiene issues, infection control improvements. And then effective use, basically the rightful use of antimicrobials. There's also an initiative to increase and improve and develop new diagnostics and therapies and vaccines, so that we don't have to deal with the infections, and we are more safe. And then if we need to use products like antimicrobials, we've got more products available. The UK is also as part of this strategy, it's signed up to and is part of the global AMR strategy with a number of nations to try and work together in reducing antimicrobial resistance. There's also you might have come across the Keep Antibiotics Working campaign. That's part of the public awareness campaign in the UK to educate the public so that they use antibiotics more appropriately and avoid inappropriate use. We're seeing increasing campaigns in schools, in hospitals, GP surgeries, dental clinics, community settings to promote the understanding of antimicrobial resistance, so that people can, deploy more hygiene measures, reduce infections in the first place, stay healthy so that they don't catch infection in the first place. And if they do, then treat only appropriately. There's also the increasing surveillance program that you're seeing more and more in the UK. There's the Fleming Fund that you can think about, which funds and tries to increase surveillance availability throughout the UK. There's the data collection, such as the Oxford studies, which looks at resistant infections and so forth, and Public Health England are doing a lot of work around that as well. In agriculture, we're seeing better use of antimicrobials. There's limits of use in farming, promotion of more kind of free range and pasture-fed animals and so forth, so that there is less infections amongst animals. They're not as crammed together, which increases chance of infection spreading and so forth. We're seeing investment in research, so a lot more of investment going on in developing new vaccines, new antimicrobials, and policies and procedures and how to manage these things across industry, healthcare, and education and other sectors. So what can you and I do? So in terms of combating, so we've heard what the government's getting up to and doing. What can you and I do? Well, it's quite obvious what you and I can do, and that is, let's use antibiotics only when we need to. Let's keep ourselves well, lifestyle, keep ourselves strong, vitamins, minerals, etc. Diet. We need to, look after ourselves so that we don't become infected in the first place. If we do get any antibiotics from our doctors, from our dentists, it's important to have the full course and not just partial, because you've not really treated it, and you're going to promote AMR by making those bacteria, the organisms inside you, more resistant to the antibiotic you just had, or the antimicrobial you just had. We need to deploy good hygiene measures at home and at work. And we need to educate each other as well. We bear a certain amount of responsibility in terms of educating our partners, our colleagues, our children, our community around this as well. And if we're in the healthcare profession, like you and I, as doctors and dentists, as medics, we need to be able to educate. We need to be able to not be so liberal in prescribing. We need to use things more appropriately, employ diagnostics more accordingly, so that we can prescribe more effectively. We should certainly be mindful of hygiene measures, isolating infected patients, adopting and maintaining protocols in our working environment. We should, I strongly believe, we should participate in, education of colleagues and the public as well. We should be aware of AMR trends, what are the new guidelines, and make sure we deploy them as soon as possible in our own lives and in our working environment. I've kind of touched on what the government's getting up to, so I won't go through that too much, except that the impetus is there. The government's working on new strategies since this one's coming to an end, towards intensifying its efforts on AMR. Certainly from a personal perspective, I can see an increasing uptick within research there, because I do a lot of research myself, and there's a lot of emphasis on looking at new products, looking at vaccines, looking at improving people's education, and what kind of organisms are floating around the UK at any one time. From a Blue Peanut perspective, we've come across a steady flow of questions, both as role plays, non-role play, as scenario-based, and direct questions as well, that come from an ethical perspective, an understanding perspective, opinion perspective. So like a question around, somebody insisting on having antibiotics for what they perceive as an infection that needs antibiotic, but you think it's a viral infection. How would you handle that situation? So this type of question comes up. In terms of role play, we've seen scenarios where you're a public health professional and you're having to educate a community around the importance of managing AMR. How would you talk to a parent from the community who is quite skeptical about it all, and it's all about cost cutting and those kind of measures? So how would you manage a skeptical person. There's also, questions around what innovations we need to think about to combat AMR. So this is more about resources, this is more about research, this is more about tech, this is more about digital, this is more about access, hygiene, etc., that you need to think about in dealing with that particular question. There was also the question around kind of socioeconomic concerns around AMR. So, so you need to think about high income versus low income, widening participation, widening deprivation issues, people coming in from abroad with different health beliefs, the migration of infection from place A to place B being a lot more possible these days, with people being a lot more mobile with holidays, etc. At the same time, the converse is mobility of refugees, asylum-seeking population, and so forth, who not only might have different health beliefs, but might bring in new pools of organisms and so forth within the UK environment ecosystem that can pose challenges to the healthcare economy. Overall, I think what I'm trying to say to you is you need to stay informed about these things. You need to read about these things, and whatever comes up on BBC Health, Google Health, and other sources that you might access for information, stay on top of it, debate, think about things, all right? So stay informed. And then don't just inform yourself, debate these things with peers, with family members and others, so that you can kind of see the pros and cons from different angles, right? Don't tend to be pro this or pro that. Look at it from different angles and be prepared to debate these issues. Always think about the empathy, i.e. looking at it from different perspectives, i.e. the patient, the doctor, the government, the public health professional, the carers, and so forth. And also think about it from an ethical perspective, how autonomy can be affected, how justice is impacted on, beneficence and non-maleficence, how all that can work in with regards to availability of therapy or non-availability or rationing, etc. If you've come across case studies in your reading, then try and use that, make it real, show yourself well informed. So that really does add colour, adds richness to the answer you'll pose to your interviewer, and that will help. Hope you've enjoyed this little session. I'll see you around. Take care.